Rheumatic fever once upon a time was quite common and has caused the great amount of the loss of life. But nowadays, because of the awareness, because of the your antibiotic use, it is almost about to extinct. But still, it occurs. But there is some amount of little bit of confusion about it. The rest as right, give on your diagnosis of rheumatic fever, go on treating, give injection, go on treating with oral penicillin, all this and that. So here, how do you diagnose rheumatic fever? 50% of the heart disease in children once upon a time was rheumatic fever. How do you diagnose? Two major criteria. Major criteria: two major, one major, or two minor something. So migratory polyarthritis, that is today's big joints. Today in the wrist, and after 2 days or so is on the your elbow. Other two, after another 2 days or so, it is on the your knee, ankle, and so forth. This is migratory polyarthritis, significant arthritis. Patient will not allow you to touch the joints, quite swollen at times. Arthralgia, arthritis. Arthralgia means simple pain. Arthritis means the pain, swollen, red, inflamed, and quite severe if the pain is. But patient will not allow the physician or the parents to touch the joints. So it is found in 75% of cases of rheumatic fever, and then carditis is found in 50% of cases. Endocarditis means changing murmur, appearance of new murmur, systolic and diastolic, and your uh, uh, peer interval prolongation. Myocarditis evidenced by tachycardia, your gallop at times, and cardiac dilation at times. Heart failure in worst possible cases. Pericarditis, where the complaint is chest pain and pericardial friction wrap, and your P wave changes of pericarditis, ST elevation, etc. and effusion, low voltage QRS complex, etc. So the carditis was present. Still, the cases you find 50% of patients carditis has, and 10 to 15% of cases has chorea. Chorea means involuntary, purposeless, non-repetitive movements like handwriting deterioration, dropping objects, waxing and waning of the hand grips, and your hypotonia, your speech slurred, your delayed knee jerk, and mental upset, in coordination, neurological signs of cerebellum involvement, and extrapyramidal part involvement has chorea presentation. And then there are a few more other causes of chorea, but this compatible clinical scenario with migrating arthritis, carditis, history of the throat infection, you have the your rheumatic chorea, and then treatment of this case CNS chorea involvement chorea is haloperidol, and your phenobarbital can be used, and then subcutaneous nodule and erythema marginatum found in small subset of cases. So these five are the major criteria. Minor criteria are your fever, history of arthritis, your ESR elevation, PRL prolongation, CRP raised, and polymer nucleoleucocytosis, streptococcal infection evidence with throat infection, tonsillitis, aesophyta, streptococcus group B, hemolytic isolation, etc. So I told that 8 or 10 minor criteria and 5 major criteria. 2 major or 1 major and 1 minor, a diagnostic of the plus supportive evidence of streptococcal infection. So not only the simple aesophyta elevation and fever, throat infection, no. So these are the 1 major, 1 minor, or 1 major and or 2 major, plus supportive evidence of streptococcal infection, diagnosis rheumatic fever. It should be diagnosed faster, and your measures should be taken because it is preventable, treatable. Penicillin to eradicate the residual streptococcus, and painkiller, the like penicillin, your aspirin and other NSAID is useful, and penicillin for 10 days eradicates streptococcus, and give ongoing the penicillin prophylactic, maybe 3 weekly intramuscular injection in the non-compliant cases, forgetful cases. In the compliant cases, you can give orally. The dose a little bit half, one third, and go on giving it for a long time until you are sure that the disease is not coming back. The then treatment of the your treatment of the your cardiac failure, heart involvement with steroids. When do you use steroid? Prednisolone. You use steroid when there is heart failure, when there is carditis, when there is cardiac dilatation, and and make sure and watchful observation of the and go on prevention of the preventive measures for the disease. Penicillin low dose, half, one third, one fourth of the regular dose and go on giving it so the disease doesn't occur. Repeated infections causes the loss of the heart valves and once upon a time has caused death of the higher amount of people, big amount of people throughout the globe, mostly in the low and low medium income countries.